Okay, it's going live. Hello everyone, welcome back to another virtual dental shadowing session. Today we have Dr. Awua with us today. He's a dental surgeon in Ghana, and thank you so much. The floor is yours.
Thank you so much. My name is Dr.Michael Awua-Mensah. I'm a general dentist. I also do a bit of content creation on the side. I also write for a local newspaper in Ghana called the Daybreak newspaper. I completed school in 2016 at the Kwame Nkrumah University of Science and Technology in Ghana. For those of you wondering where Ghana is in the western aspect of Africa. So we share borders with we share borders with Ivory Coast. We share borders with Burkina Faso. On the south of Ghana is the Atlantic Ocean. So I work as a private dentist. I do part-time at a private dental clinic in Ghana. Most of you will be wondering, why did I enter dentistry? So initially, I didn't want to do dentistry. I actually wanted to get into the medical field. Even prior to getting into the medical field, if I can recall rightly, when I was in high school, I actually wanted to become a mechanical engineer. Solely because of the fact that my dad knew cars, and I was also enthused about the fact that whenever he's going to a mechanic, I follow him, I look at how they fix cars and all. I just wanted to help people whenever their cars break down and all that. But I got into senior high school, and that's when I actually took courses in biology, anatomy, and all that. And I realized that it was quite fun. So I branched into doing something in helping people, not necessarily fixing cars. And upon shadowing some few dentists in Ghana, I fell in love with dentistry and I applied for dentistry in school. So what are the things that made me a competitive applicant? So in Ghana, when you're done with high school, your grades need to be good if you want to enter dentistry or medicine. No two ways about it. It's a bit different from how things are done in the US, where you need an undergrad for dentistry. In Ghana, right after high school, you can apply to enter dentistry or enter medicine or enter engineering. So one of the main focus was actually getting very good grades to enter dentistry. And we had an interview, all right, to screen the people who actually wanted to enter dentistry. There are certain key things that some of the people on the panel wanted to know from us. They needed to know that we're excited about the profession of dentistry, not necessarily because maybe somebody didn't get medicine and was left for an option in dentistry and had to do it like that. They had to find out that we're really excited about the profession that we're getting into. And I would be very honest with you. When I was entering dentistry in 2010, I quite recall that there was not much fuss about dentistry in Ghana. I didn't really know a lot of dentists who used to put their work on social media or maybe even advocating for good oral care on social media. There was nothing of that sort during my time. But right now, in Ghana, you've got a couple of dentists talking about how dentistry is, making the profession exciting. But during my time in 2010, I never had that. So entering a field like that, the only thing I could rely on was shadowing dentists in my field. They made it a bit fun for me, but on social media, I don't recall seeing any dentists actually talking about dentistry. So I actually took this upon myself somewhere in 2019 to try and advocate for good oral care, oral health, tell people about what dentistry entails and all. And I feel that there's been a change in the paradigm. I have people now interested in getting to pursue a course in dentistry. One other thing they wanted to find out from us was that you needed to be detail oriented. So some of the questions they asked us was that what were things that what were hobbies that we used to do. So for instance, some people would say maybe they like painting, anything that had to showcase your manual dexterity. You have to know some of these things. You know how to play the piano, things you could use with your hands. Because in dentistry, it's a lifelong profession where you're going to use your hands to do so many things, except the fact that maybe you enter public health where you fill in documents and do research. But dentistry, clinical dentistry, you need to be very good with your hands. One other thing that also made me a competitive applicant that the panel actually were keen about was the fact that you have to be comfortable with close interaction. Bear in mind that dentistry is not a profession where you hide somewhere and you don't meet the patient, or the patients are somewhere, your clients are somewhere, you're also somewhere. You're actually in close proximity with the client. You should be somebody who's comfortable with close interaction. You shouldn't get shy of the patient, or probably maybe we are trying to assess a condition of chronic halitosis, and the patient opens the mouth and you're like, this smells. No, you shouldn't be doing that. You should really, really be comfortable with close interaction, trying to find out the patient's problem, making the patient feel comfortable within your surgery. And one other thing we assessed on was the fact that you also have to be a good communicator. So a good communicator in the sense that you should be able to explain certain treatment plans to patients. You should be honest with the patient. You should be confident. You should be good with public speaking, honestly. Dentistry actually taught me that I'd be good with...
Sorry, can you hear me?
Yeah, hello, can you hear me?
Yeah, it's good now.
Is it better now? Yes. So I was talking about the good communication. So you should be able to talk to people, talk to a group of people, talk to their masses. It plays a really important role if you want to become a dentist. So what my work experience has taught me. Okay, so as I said, I had my education here in Ghana, Awua-Mensah University of Science and Technology, for 6 years. And after 6 years, I completed in 2016, and I've been practicing dentistry, I would say close to 6 years now. Yes, and these are some few factors that I realized you should have as a dentist. From my experience, you should have good judgment. You should be able to know at what point you're going to extract a tooth and at what point you need to actually save the tooth. There's something that my lecturer taught me back in school. We call it hierodontics. Hierodontics is the sense that you know that this tooth cannot be saved, but you're trying as much as possible to do certain things to save the tooth. At the end of the day, the patient very annoyed to the fact that he knew this tooth couldn't be saved, yet he still went ahead to try and put certain things in place to save that tooth, and it didn't work out for you. You should be able to call a spade a spade. Once you realize that, you know what, this tooth can be saved, let's take it out, get you an implant, get you a bridge. You go ahead and do that. You don't try to become a hero to try and sort certain things out where you know it shouldn't be that way. You should be able to organize your time well. Good organization is really, really important. You should be able to organize your time well, organize your nurses well, even organize the people around you, because time management really plays a role. Because, for instance, doing private clinical dentistry has taught me that time plays an important role for us, because you're seeing all these patients within a specified period of time, booking appointments, but the patient cancels, you need to get somebody in and all that. You should be able to organize your time well. You should have very good critical thinking skills. When I say critical thinking skills, before you do a procedure, you should have thought of so many ways that particular procedure can be done. You should be able to be reading your notes, your past notes, reading on cases similar to yours to see maybe if this case fails in this way, you move to a plan B. If plan B doesn't work, you move to a plan C. You should be able to think critically about the procedure that you're doing. You should be very, very professional. Well, I wouldn't overemphasize this. You should be professional at work. There are certain things you wouldn't do at work. You wouldn't go to work drunk, dressed shavishly. No, you should be really, really professional when it comes to the job in dentistry. You should be able to negotiate very well. Sometimes these insurance companies approach us, and sometimes their insurance limits are quite low. Because sometimes working in the private field, I realized that our charges are a bit on the high, but certain insurances that we're trying to sign on, they bring the insurances, you realize that they're a bit on the low side. You should be able to negotiate with the insurance companies to meet them halfway, so that you also don't end up running at a loss. You should be able to network very well, because I've realized that networking has really done a lot for me. Apart from social media networking, also networking with people, playing golf has taught me to network very well. I get to meet people on the golf course. Some even end up being my patients. So you should really be able to network very well. As I said earlier on, you should have very good manual dexterity. I wouldn't lie about that. You should be able to work with your hands very well. And also maintain continuing education requirements. If you stay at one point for a very long while, you become very rusty. Dentistry is such that we are continuously learning all the time. You don't finish learning at one point. You're always learning, updating yourself on certain procedures that are done. For instance, one of the days where we used to use amalgam to do fillings, now we use composites. And now, for instance, the traditional bases that are being used to close teeth, now we have the clear aligners to help actually close gaps and improve people's smiles. So all these help for you to grow as a dentist. What is a typical day like as a general dentist? Most of my patients consent. In fact, let me give you this narrative. An average Ghanaian would only visit the dentist when there is toothache. There's little advocacy for dental education in Ghana. Most people don't see the need, mainly because they don't know, and also as a result of the cost of visiting a dentist in Ghana. It's not that it's that costly, but people prioritize other things before visiting a dentist. For instance, you need to pay the fees of your children, school fees, you need to take care of the home, you need to provide a stipend for your wife, you need to do certain things even before you think of taking yourself to go and visit the dentist. So one of the major issues that really affects us is the low advocacy for good oral care. So an average Ghanaian will come to you only when he or she is in pain. Even before they come to you, they would have applied a lot of herbal medications or herbal concoctions to the painful tooth before they come. By the time they come to you, there's a swelling, there's an abscess, you need to drain the abscess, and even in instances, you can't even do a root canal treatment, you need to extract the tooth. So one of the major patient concerns is toothache. The other thing is also gum disease, something we noticed for individuals between the ages of 16 and 30 years, especially when they come with pericoronitis, when there's an inflammation along the gum area of your wisdom tooth. So what happens is that the fact that they have gum covering the wisdom tooth and food packs under the gum, you don't visit the dentist regularly. So food keeps packing there, the place gets inflamed, they come to you and you end up doing cutting the gum away by a procedure we call an epiculectomy, or if you realize that on the x-ray the tooth is actually impacted, we do a surgical extraction to take it out. And one other thing that is a prime concern for many people too is bad breath. Bad breath is of prime concern. But you'd realize that when COVID actually came, we started wearing face masks, and people were not too concerned about their breath. But it made some people conscious of their breath too, because whenever you talk into a face mask, you're smelling, you get a double dose of what you give to people. So it's also one major issue that people actually come to the clinic for. We check to assess the causes, whether it's an intraoral cause or probably it's coming from outside the mouth. We try to ask them questions to guide them to know where exactly the problem is from. Another thing too that usually affects the geriatrics is the missing teeth. So most of them started to have periodontal disease during maybe their middle age towards old age, and when they lose their tooth, they come for us to do replacements for them. But the toughest part about proposing a treatment plan to patients is the treatment fees. You can draw a very good treatment plan, but at the end of the day, the onus lies on the clients. Because if they don't have the ability to pay for the treatment, you end up doing another, or probably meting out that, which to you wouldn't have been the best, but due to financial constraints, you need to actually do that for the client. Because it's quite painful to see certain cases where you feel you could have done something, or probably you could have engaged the services, or probably an orthodontist, but due to the fact that the patient cannot really afford, you end up doing something within their price range. Yes, so this case you see here on your screen, this was a 94-year-old lady who came to the clinic. This was last year. She was a known denture wearer, but unfortunately, she stopped wearing her dentures because they were not fitting well, and she needed a new set of dentures. This was a very compliant lady. She was quite motivated, and that's really one of the reasons why I actually said treatments for her. So there was an option of her getting an implant supported denture. Due to financial constraints, she couldn't. One of the major issues with this case, or the difficulties I experienced with this case, was that the bite was collapsed, and there were other badly broken down teeth that had to be extracted. And one of the things I actually wanted to do for this lady was to extract these teeth you see on your screens and do a full denture for her, because I felt that would actually suffice for her case. But this lady didn't want to take out any other teeth in her mouth. She was really adamant. I convinced her that, you know what, we need to take out these remaining teeth and we do a denture that will be more retentive. But she wasn't. She didn't want to go ahead with that. So we did a study model. We checked how the bite was. We also did the primary impression, did the secondary impression, and we started to make the denture for her. So as you can see, we incorporated some clasps in the denture in order to improve retention for her. But at the end of the day, she had new set of teeth that she really liked. Now she was able to chew. She was able to now start going out to see friends and all. she really liked the denture at the end of the day. So sometimes, as I said earlier, you can actually propose a very good treatment plan for a patient. But at the end of the day, the onus lies on the patient, especially if she wouldn't want to have the teeth taken out. Then you need to go ahead to do a partial acrylic denture for the client. So I'm moving on to the next case. So with this case, this was a 19-year-old gentleman who presented to me on account of a fractured anterior tooth due to childhood trauma. So what happened was that he endured some childhood trauma when he was quite young, probably at the age of 8.5, 9 years. It was more of an assault. He was living with a lady who was not really the mom. The dad married someone else, and this whole he's not my child and all that. And I think one time, according to him, he says he went to eat some food which wasn't his, and the mom got really annoyed and hit him with an object, and he fractured his tooth. And he was not able to tell people the real story of what actually happened. He grew up even telling his dad that he fell down and broke his tooth. And this gentleman had lived with this for a very long time, and he realized that he was aging. He needed to have something done about the tooth. So he came to me, explained his problem to me, and let me know his financial constraints. And I took it upon myself that, you know what, I'm going to pay for the treatment. I'm going to foot the bill for all this, because most of us are not, some people are not privileged to have somebody pay for dental treatment. And once he was motivated and I listened to his story, I decided to take care of his treatment. So with this, what I did was that I checked the bite, and I did a sensibility test to check the vitality of the tooth, whether the tooth was alive or whether the tooth was dead. Because trust me, at the age of 8.5 years, sometimes the roots are not fully formed properly. So I needed to take an X-ray, see the apex of the roots to make sure that the apex of the root had closed properly before I started anything. So the sensibility test showed no response, meaning the tooth was dead. I went ahead to do root canal treatments in this case. So this was a single visit root canal treatment. I did extirpation, I filed, and I obturated. So this was not a rotary, this was actually a manual root canal treatment that was done for him. And afterwards, I restored with composite material. There was no need to put a post inside because there was adequate tooth material. And afterwards, I decided to do an Emax crown for him, but I don't have that picture here at the moment. But this was the after picture, the composite filling that you see. But afterwards, I did an Emax crown for him. Let's move on to the next case. Okay, so with this case, this was a client who presented to me on account of peg-shaped laterals and fractured anterior teeth. So upon assessment, I realized that these teeth, we could have decided to crown the peg-shaped laterals, but I realized that crowning the peg-shaped laterals would mean that there will be chances of cutting too much tooth tissue, and we may end up entering the pulp of the tooth. So in her case, what I decided to do was that I decided to add on a bit of some composite material to the peg-shaped laterals, and the fractured centrals, I decided to also add more composite material there. And she was actually glad to have her teeth restored. And this is somebody who had been struggling to smile for some time now, and restoring the tooth with composites on a one visit really put a smile on her face. Okay, so the hardest thing about being a dentist, actually felt that as a dentist, the impact of COVID was actually the hardest thing that really really affected me, because back in 2020, you realized that a lot of the dental clinical operations were shut down temporarily just for elective cases. So maybe a patient coming to you with pain and all that, but it also generating procedures, we couldn't perform them. It really took a toll on a lot of dental clinics in Ghana. Back then, I remember I was working for one dental clinic, and at that point, because of COVID, we couldn't be going to work all the time. Only when end calls, you consult the clients and maybe realize that the patient's already taken pain medications, they don't work, then we see the patients at the clinic, probably do an extraction for the patients at that point. But any aerosol generating procedure, we couldn't do it. And you realize that in that case too, our finances also come down. We're able to run the clinic properly. So it's like we're running at a loss. So the only emergency cases that we were seeing. But upon the COVID pandemic, I learned two lessons. First and foremost, I realized that nothing is ever promised to us. We need to take each day like it's our last, because we realize that most people put a lot of their plans for the future course, realize, maybe I need to probably enter a specialization course, go like, you know what, there's more time, I'll do it later. You don't know what's going to happen tomorrow, because COVID really disrupted a lot of our plans. So on the bright side, I realized that we need to always have it in mind that nothing is ever possible to us. And also the sad reality that most of my colleagues who are in the medical field were also passing away because they were frontline workers. So at the end of the day, it dawns on you that our job is about service. We are here to serve people, and in the process of serving people, there is a chance of you actually losing your life. So these were actually the two lessons I learned from the COVID pandemic that affected us in 2020. It was the hardest thing that really hit me as a dentist. Okay, so here my contacts, just in case you would want to contact me. My number is on your screen, my email, my website, that's www.drtiwa.com. And in case you have any questions that you may not be able to ask here, you can also hit me up on my Instagram handle. It's the same on TikTok, on Twitter. I also have a very amazing YouTube handle where I talk about oral care and give tips and all that. So I think you should subscribe to my YouTube channel as well. So I'm available for any questions.
Thank you so much, Dr. Awua. That was very interesting.
You're welcome.
We have several questions. What is the podcast that you're working at? What is that about? The podcast?
The YouTube channel?
Yeah, like you said, you work as a television. You go talk on the radio.
Oh yeah. I think me being a content creator. Yes. So I realized that in dentistry we are not too confined to the clinic. Apart from being in the clinic, you also need to be trying to put out let's say educational videos and all that. So apart from that, I do a bit of some YouTube blogging as well. I write in the local newspaper in Ghana called the Daybreak newspaper every Tuesday as a columnist. From time to time, I do some few TV gigs or some radio gigs as well. And recently, I started one Instagram. Should I say a 10-minute video where a colleague of mine, we sit down and we talk about certain questions that patients in our DMs, we talk about, we try to explain certain things to people who can't afford to come to a dental clinic to have such explanations. We do that. It's not like a podcast, but it's like a mini video, mini podcast on my Instagram page.
That's very cool. And they can also find the video, the radio on the contact info that you put before, right?
Yes. They can also find it. Especially my channel. That's why I put a lot of my content on. And I have this review playlist where I review a lot of toothpaste on the market, because I realized that a lot of consumers go to go to the supermarket. There are so many toothpaste around. They don't know which one exactly to buy. So I more or less take every toothpaste. I give a breakdown whether it contains fluoride, any specialized ingredients that are going to help people. Because you realize that a lot of people go and see the dentist, and the dentist tells them that, oh, you know what, any toothpaste that contains fluoride is fine. But there's more to it. There are certain specialized ingredients that you need to look for that help to reduce sensitivity, that help with gum disease and all that. So I do a breakdown of in fact, most of the toothpaste on the market, I do a lot of breakdown on that on my page.
Yeah, for sure to check out his radio page and also the other content. And so I think you talked about getting into dental school in Ghana. Can you explain a bit more about like from high school to there? And it takes 6 years, right?
Yes.
For the program.
It takes 6 years.
And how is the program like?
Okay, so in Ghana, if you want to enter dental school, there are two routes. The first routes are for people who actually schooled in Ghana. The second routes are for let's say people who schooled outside the country, had a dental degree, want to work in Ghana. They wouldn't have to go through the whole 6 years. So for people who schooled in Ghana from high school, you entering dental school, you need very good. You go through an interview. First, it's 6 years. First 3 years, you do a course. You do a course in human biology. So you do anatomy, physiology, behavioral science, algebra, basic sciences for your first 3 years. You do pathology too as well, but these are being done with your medical colleagues. You do that for the first 3 years, and then the last 2 years it's more dentistry. First 3 years after the basic sciences, you do a bit of medicine, a bit of surgery, then you branch into dentistry proper in your fourth year. So from fourth year to sixth year, you now handle the dental course properly. So for somebody who comes from another country to come and start working in Ghana, you do a 6-month top up. So you need to prove that you've actually had very good dental training in your country, and you more or less shadow other dentists in the teaching hospitals for a period of time. Then you write an exam, and once you pass and you realize that you've met all the requirements, you then get your practice in Ghana.
Mm-hmm. Okay, and have you considered working in other countries?
Yes, I've actually considered. I've actually explored those areas. I think at a point I was thinking of probably migrating to the UK, but I realized with UK you'd have to worry the overseas registration examinations or so, and it's something that I looked at. I also looked at Canada and I also looked at US, but these are things that I'm considering maybe in the next 1 or 2 years. But for now, I'm trying to focus in Ghana and see how it goes.
That's very interesting. But you say you have been looking to other countries, but do you know, is there any huge difference between Ghana and the other countries, or you're not sure?
I'll say the difference would be the fact that upon my interactions with a couple of colleagues in US, in Canada, I feel they are more on the cutting edge of dentistry. Dentistry is always improving, and I wouldn't want to be at the tail end of dentistry. I always want to be at the point where you're using laser, we're using all these types of procedures to actually meet the patient's needs. I wouldn't want to be doing things that maybe 10 years from now, we'll still be doing the same thing. These are things that push me to actually try and get into other countries to see what else they're doing there to also improve upon myself.
Yeah, that's really good, because I think US has really good education about medicine and all that.
Yes.
Do you think there's anything that the government in Ghana can do to improve oral health?
Yes, great question. So just last month, on the 20th of March, we celebrated the World Oral Health Day, an annual event that's organized by the FDI World Dental Federation. I happen to be a social media ambassador for the event, and the whole the whole aim was to try and get individuals to take very good care of their oral hygiene, get certain youth groups to also try and facilitate programs to have people know more about the oral care, and also get the government to also champion oral care, because I realized that oral care is not really a main focus for most governments, even though we can say that oral diseases affect at least 3.5 million people in the world. So I feel that the government needs to actually try to prioritize oral health in Ghana. I think apart from the fact that the World Oral Health Day is an event held once every year, I feel it's something that we should be, apart from it being an event, it should be something that every Ghanaian should actually be enthused about doing, trying to take care of their oral care, visiting the dentist, cutting down on sweets. It shouldn't be a one-time thing that we do on the 20th of March, but it be a habit, something that the government puts in place, maybe adding it to a school curriculum where school children are supposed to visit the dentist, or have a dentist come over maybe every quarter of the year just to educate people. I think will go a long way to help the country as a whole.
And do you work as dental volunteer, traveling to other countries?
Yes, so I do a bit of volunteering in Ghana. Whenever certain groups contact me, certain churches, certain youth groups contact me, I go there to do outreaches, screen the kids and all that. It's something I do on the side. But I wouldn't say there's an organization where I do a bit of dental volunteering at the moment. But it's something that I'm looking forward to do.
But so do you accept people who probably go there and help you also do the volunteer?
Yes, I do.
Because for me, I'm going to Kenya probably this summer to do volunteer. I think that would be cool. But is there any suggestion that you think that we should be care of, and things that we should be prepared before we go?
Things you should be prepared before you go to Kenya.
Yeah, or for dental volunteer in general.
Dental volunteering. Okay, so with dental volunteering, what I would suggest is first of all, you should plan properly. You should plan especially when you're going to countries, for instance, with the western side of Africa. One of our major hurdles is malaria. So with malaria, you need to actually get your malaria vaccine or get medications ready, any anti-malaria that you need to take before you come to, for instance, West Africa. But for Eastern Africa, where Kenya is, I can't really tell which tropical disease is endemic there. But in Western Africa, it's malaria, so you need to plan towards that. And you should also have it in mind that most of the locals, for instance, Western Africa in Ghana, as I said earlier, most of the locals are not really enthused about oral care. They are not really enthused because, first of all, they don't really know much about it. So you should be able to explain certain things to them using very simple words, simple diction to explain certain things to them. And when it comes to treatment too, if you're able to even met out treatment, if it's maybe an atraumatic restoration that you can do for them, maybe if it's a GIC that you can do at that point, I think it will go a long way to help them. So not just screening them, but also probably meting out certain treatments. If you can even have like a mobile dental check to really do cleaning for some of these people, I think they would really, really appreciate it. Because some of them don't even have dental clinics within their vicinity.
Yeah.
So
thank you for the suggestion.
As well would really help.
I'll take those suggestions into account. And so you said that for you, dentistry is not you don't only do dentistry, you do other stuff. So what is a lifestyle like as a dentist in Ghana?
A lifestyle as a dentist. So in dentistry, you can decide to work in the government or public sector. You can decide to work in the private sector. I've worked in the government sector for 2 years before I left government to work in the private sector. But what I've realized is that with the private sector, you get to have more time for yourself as compared to working in the government sector. Government sector, and you really don't have too much time for yourself. And the fact that in the private sector, you get more time for your client. So you're able to interact with the clients and see their needs, educate them on good oral care. However, in the government sector or public sector, there are so many patients waiting to be seen. So you don't have the luxury of sitting down to get information from the patients. You don't get time to actually take your time to do certain, maybe a procedure that you can actually do a single visit root canal. You can't decide to do that in the government sector. You need to space out the procedure. And apart from that, even in the private sector, because I'm able to manage my time properly, I'm able to do certain television interviews, go to do radio interviews. I actually get time to do other things apart from dentistry, which I thought it's a plus.
Yeah.
Actually, a plus. Yeah.
So it's not as the schedule is not as packed in
Yeah.
private.
Yes.
And how many days do you work a week?
Okay. So okay. So, I've changed my initial workplace where I used to work from Mondays to Fridays. Right now, I'm doing part time at another clinic where I do Tuesdays to Saturdays. So I actually go on appointments. So Mondays I don't go, on Sundays I don't go. So Tuesdays to Saturdays, whenever there are appointments, then I go and see the clients.
So basically, being a dentist, like your schedule is very flexible, and you can choose which day you want to work.
Yes.
Yeah.
Currently, I've made it a bit flexible, but initially that wasn't the case. I was going to work every single day, but now it's a bit flexible to the extent that I manage the appointments that I see in a particular day. I go and then I see them when I come.
And we have 3 more questions.
Sure.
So, what are your suggestions? Because you said that we have to be professional. So, what are your suggestions to be professional in front of the patient? Like, what are some ways to do that, to improve on that?
Okay, so being professional could mean so many things. There are certain patients who don't follow post-operative instructions. For instance, you do an extraction for a client. You tell the client, you know what, when you go home, don't smoke, don't spit, don't do this, don't do that, don't rinse your mouth on the day of the extraction. They get home, they do the opposite. They come back to you on the second or third day after the extraction with a dry socket. And sometimes you wonder, sometimes at that point you're like, I explained this to you, but you did the opposite. Sometimes compliance is really an issue. So being professional is that you try to sympathize with the patient, even though you know that was the patient's fault. You don't necessarily rub it in the patient's face. You try to speak to a patient in a way that he or she feels comfortable in a sense that, oh, I know I made a mistake. The dentist wasn't too pissed about it. I'm still coming to see you. And in the sense that also in terms of how you also dress, you shouldn't be looking all shabby and all when you're talking to the patient. And also, when I talk about professionalism, too, you should be able to lay down all the possible treatment options for the patient. Just because maybe you don't do implants at your clinic, that doesn't mean that they suggest implants as an option for the patient. You let the patient know all is available. If the patient chooses for the implants, you can refer to another dentist who actually offers the implant service. But I realize that there are certain who wouldn't discuss all the available treatment options for the patient because they would want to met out a particular treatment for the patient. That's not professional. And that's very, very wrong. Yeah. So these are some of the things that you need to look at when I talk about professionalism.
And in the case one that you show, so
yes,
why are the roots of the teeth of the denture are seen?
Pardon me?
Like you see, there's on the denture, you can see the roots of the teeth on the denture.
On the denture.
Yeah. Why did you do that?
Yeah. So with the dental technician, I think one of the reasons was that he realized that on the other teeth there was a bit of some cervical abrasion going on, and he didn't want the artificial to look too. He wanted to look a bit more natural, so he ended up, let's say, making that side look a bit more translucent for it to mimic somebody who's that old, because she's actually 94 years old. So he tried to mimic that a bit for the teeth to look more natural for somebody in that age range.
And the last question is, do you think your dental school prepares you well?
Okay, so dental school prepares you, I would say, 70%.
70%.
Yes, the rest you need to figure out on your own.
Yeah.
That's from experience. You doing certain treatments and all that. You gain most of them after dental school. Dental school is going to give you a bit, it's going to spoon feed you a bit. A majority of what you learn in dentistry is after you complete school. And that comes with experience.
And how many years did it take for you to feel comfortable working?
I would say after a year. After a year. The reason I'm saying after a year was that the first year I was actually practicing at a teaching hospital where I finished, where our school was. So I did the first year there, but at that point we were supervised a lot of times. The second year, the supervision was a bit little, and we were able to actually stand firm and do certain things on your own. So I felt that I got that confidence in my second year of practice, because the supervision wasn't as much as my first year of practice.
Got it.
Yes.
And thank you so much. I think that's all we have for today. And for the
Thank you
viewers,
so much for having me.
yeah, thank you. Like, really appreciate it. It's a new idea about other countries, because we never have a dentist from Ghana for the interview. And for the viewers, we'll post a quiz, and remember to do it before the 24 hours. Thank you.
Thank you so much for having me.